Hello everyone, you are all welcome to lecture number 1284, and today's topic is Hashimoto's disease. Hashimoto's disease is commonly known as Hashimoto's thyroiditis disease. It is autoimmune disease where your thyroid gland they get inflammation and they are damaged. And because of this reason, the thyroid gland is not capable of producing enough thyroxine, that is hormone. And that hormone is taking care of your lot of metabolic process, your nerve, and also some other important functions where your nerves are activated. So in that condition, we have to study how far it is damaged and what are the causes and risk factor of getting Hashimoto's thyroid disease. So it is autoimmune disease means where your immune system cells they mistakenly start attacking the thyroid gland cells, and once these cells are attacked they are damaged in large quantity, and once they are damaged they are not capable of producing enough hormone, and once enough hormone is not produced then we will suffer from hypothyroidism, means there will be deficiency of iodine, because iodine is very important element which plays role in production of thyroid hormone. And the risk factors are first genetic factor, where your family history, if they have this inflammation of thyroid gland, there is maximum chance of getting that disease. And the second one is if you are exposed to some heavy metal or some ions or some radioactive material for a long time, you are working somewhere, maybe in oil sector or some other sectors where radioactive materials are used, that is also one of the factor. And the third factor is that if you are already suffering from some chronic inflammation and autoimmune disease where your some of the organs are involved, like insulin production, where your pancreas is already under attack by immune system cells, and also your kidney is affected. So in that circumstances there is maximum chance of getting this Hashimoto's disease, that is the inflammation of thyroid gland. Let me show you the image of that one. Here you can see very clear picture of thyroid gland, left and right lobe, and below you can see the trachea, and these are known as thyroid glands, and they are producing thyroid hormones. And if these glands they are damaged because of inflammation due to attack of immune system cells, and then they will be in the form of swelling or bulging around that, and there will be deposition, and that one will be in the just like some material is hanging behind the below the chin, and that image I am showing. So now here you can see very clear picture, one where those two left and right lobe of the thyroid gland, and once it is damaged you can see below the chin in your neck there is some substance bulging, or just like your neck is having some swelling position where actually these damaged tissues are collectively present there. So once treatment is done by injecting the synthetic thyroxine, that is thyroid hormone or hormone therapy, then it can be recovered. So here I have given in the form of subheading of risk factor, symptoms, and treatment of Hashimoto disease. So number one is Hashimoto's thyroiditis is an autoimmune disease. If I say autoimmune disease, it has broad meaning, broad spectra. And once you are suffering from autoimmune disease, means your whole body may be affected. And I have already discussed this issue thoroughly. Autoimmune disease means where your normal immune system cells, they start attacking to your normal cells in any part of the body, whether organs, skin, hair, kidney, liver, any part. And that is called autoimmune disease. So here in the case of Hashimoto's disease, the immune system cells, mistakenly they are attacking the normal thyroid gland cells, which are responsible of producing thyroid hormone, that is called thyroxine. And once it is totally damaged, then surgery is the only option. Otherwise, if it is a little bit damaged, much is not damaged, then medication or some treatment is possible. So here I have given Hashimoto's thyroiditis is an autoimmune disease that affects the thyroid gland, leading to hypothyroidism. Hypothyroidism means where enough thyroxine hormone is not produced and your body will be having deficiency of iodine, because iodine is required to produce this thyroid hormone, and that is underactive thyroid gland, that condition where thyroid gland is not active, it is inactive or underactive. The immune system mistakenly attacks the thyroid gland, causing chronic inflammation and damage of thyroid gland. It is inflammation, chronic inflammation of your thyroid gland, and because of that you will be suffering from Hashimoto's disease. Number two, the risk factor of Hashimoto's thyroiditis. So number one is genetic factor. Your family background, family history plays important role in the development of Hashimoto's disease. Number two, autoimmune disorder. I have already told you autoimmune disorder means your some other part of the body, they are already suffering from autoimmune disease like diabetes type 1. In that situation, there is maximum chance of getting this Hashimoto disease. Number three, environmental factor. Environmental factor means once you are working somewhere where you are exposed to radioactive material or some toxic chemicals like heavy metals and some highly polluted air, these are all environmental factors of, that is risk factors. Then number three, that is your symptoms of Hashimoto's thyroiditis disease. So the first symptom, you will feel tired, always feeling tired or having fatigue with low energy. That is the first symptoms of your feeling. Number two is weight gain without any reason. You will start gaining the weight. Number three, cold, that is intolerance. Cold intolerance means you will feel lot of cold, while some people may use only half sleeve or no sweater, but you will feel that to put the coat and overcoat. So you become very, I can say, super sensitive to your cold temperature. And then that is number two, that is, number three, cold sensitivity. Number four is hair loss. your drastically you will notice that your hair is becoming thin and there is loss of hair. That is also one of the symptom of Hashimoto's disease. And then number 5 is mood disorder, anxiety build up, depression. That is also irritation is also one of the symptom. And then memory problem and concentration. It will be difficult for you to concentrate on some object, or it will be difficult to recall some past memories. I mean, slowly there will be loss of your memory. Then number 4 is treatment of Hashimoto's disease. Number 1, thyroid stimulation hormone test, that is called TSH, and this hormone test TSH levels can assess the level of thyroid function. Once that level is checked, the doctor will tell you, who is dealing on the basis of TSH, that what is your condition. And number 2, thyroid ultrasound test. Thyroid ultrasound test is done to check the inflammation and the size and the structure of thyroid gland, how much it is damaged. On that basis, doctors can recommend the medication. Then number 3 is medications. The very common medications are either you go for anti-inflammatory drug, or that is your immunosuppression drugs. Usually these drugs are given to such type of patients. Then lifestyle change. If I am saying lifestyle change, it's very important. You have to add in your diet mostly anti-inflammatory food. Now, for a common man, everybody is not chemist or scientist, how to identify that which food is anti-inflammatory? Most of your foods, vegetables and fruits which are deep in color, and some very important one are identified like ginger, adrak, and then turmeric. So these are all then your green vegetables, some fruits, colored one like mango, like watermelon. They are all contributory factor as anti-inflammatory foods. If you add, at least they will reduce the inflammation level of your thyroid gland. Then number 5, finally, if it is too much damage, then only surgery is option to remove this damaged thyroid gland, and you will be subjected to synthetic thyroxine hormone for whole life. So here I am again repeating, several times I have already told you, the difference in balanced diet and nutritional food. There is a big difference. If we say balanced diet, means your diet must be full of antioxidants and anti-inflammatory phytochemicals, and only deep colored fruit and vegetables, they are the rich source of anti-inflammatory and antioxidant compounds. So in your diet, you add 80% vegetable and fruit and 20% any rubbish, I mean meat, red meat, fat, whatever it is. But you have to add 80% in your diet, that they are known as anti-inflammatory foods. With this, I will stop. Thank you very much for watching the lecture.